Modi.
Thank you, Mr. Speaker. This question is for the government representative. Senator Gold, as you know, there is a crisis in pediatric health centers across the country. Last Friday, at the Hospital for Sick Children, half of the children were on ICU on ventilators, and the spike of respiratory illnesses have prevented surgeries, cancelled emergency room access, and flooded intensive cares. Halifax IWK set a record a week ago with the highest number of seriously ill patients. CHEER opened a second ICU with an unprecedented demand. Senator Gold, I understand and I agree with the federal government's position that money is not the only solution. There needs to be system change. Nevertheless, we are in a crisis. Despite the recent failure to make progress on health funding at the recent FPT Health Ministers meeting, has the Minister of Health re-engaged with his provincial and territorial colleagues to seek pathways for meaningful collaboration to address this pediatric health crisis?
Senator Gold.
Senator, thank you for raising this issue. It's a concern to all of us, parents, grandparents, and citizens alike. And you're right, it's not just money, even though the federal government has made enormous investments in health recently, as I've outlined on other occasions. You mentioned the recent meetings of the federal health ministers. It was the first meeting since 2018. It did not result in the progress that the government planned for and the government hoped for. Since the beginning of the year, the federal, provincial, and territorial officials worked collaboratively to prepare concrete action plans to advance the use of health data and digital health for Canadians and to support health workers. Regrettably, instead of allowing health ministers to do their work and engage in a constructive and meaningful collaboration and conversation about the future of healthcare in this country, the premiers forced them to speak only of money and not the means of improving the system. This is not a plan. The Government of Canada calls on the premiers to allow their health ministers to do the work with the Health Minister of Canada to ensure that the long-term survival of Canada's universal and publicly funded healthcare system survives and flourishes.
Senator Modi, supplementary.
I do. Thank you, Mr. Speaker. The crisis in pediatric health care, Senator Gold, is not limited to the hospital, but to the drugstore, where Canadian parents have struggled to find basic medications for their children for a number of weeks now. For added context, a recent article in the Canadian Medical Association Journal argued that Canada has very little pharmaceutical security, that is, the ability to ensure our supply of drugs is not disrupted by supply chains. Senator Gold, the government announced that it has secured a shipment of drugs in the severe shortage right now, just yesterday. This is obviously welcomed. Is there a plan coming to ensure Canadians can be confident that they will have access to basic pharmaceuticals when they or their loved ones need it?
Senator Gold.
Well, thank you. And yes, indeed, thank you for your question. The government is pleased that it was able to secure an additional foreign supply of children's acetaminophen. It'll be available for sale in retail and community pharmacies in the coming weeks to help address the immediate situation. The longer-range solution requires not only federal government action and provincial government action, but also the private sector to increase our capacity, whether it's in the which is already significant in the drug, in research into the drugs and the drug production facilities. And that is something that is in the long-term interest of Canada.